Hi Alexa, how are you today?
I'm feeling good.
Good. You came into the practice today to get your first Reiki treatment,
Yes.
and it was about a 30-minute treatment. And would you like to share what you thought about it?
So when I came in here, I had no idea what to expect.
Huh?
I learned bits and pieces of what I could about Reiki, and I was really open to it, and I was open to whatever I was going to experience, and I really enjoyed my experience, and I try and put into words how I really felt about it, and I try and kind of comprehend what was going on, but I have a lot of questions, and because things that I felt were very abstract to me, they were very they were relaxing feelings, but they were also kind of sensations that were going on that I don't think I've ever felt before. Feelings of really light but also pressure. I felt my body it was tense, but I was also very loose and relaxed at the same time. I would have these pangs every now and then throughout my body, but then you would put your hand on them like you moved your hand from my chest down to my knees, and they would just stop.
And you didn't know why.
Yeah.
Okay. Do you mind if we share why you were here today?
Yeah.
Okay, so you had said that you were stressed in a sense because you're overwhelmed with school and a lot of work, a lot of studying, a lot of reading to push through the night, right?
Mm-hmm.
So, your body has that tension because you're trying to figure out how to do everything, and it's hard to go to sleep. Eating is off, it's not on a regular schedule, so it's hard as a college student, right?
Yeah.
Right, so your body has all this stuff on the inside. Now, with the Reiki, what I did was I just asked for you to receive whatever you needed. And I just started with a distal, in a sense, your shoulder and your leg to be able to match your breathing and to see if I can feel the energy move from your shoulder down to your knee. And I didn't. So after a few minutes, I placed my hand on your chest. And then I realized you really weren't breathing deeply in a relaxed state. And did you notice anything shift when I moved my hand from your shoulder to your heart area?
A little bit. I kind of felt a little bit more aware of how I was breathing. Yeah, and I was thinking actually what was going through my mind during that time was when I'm really still, usually I get a little bit rigid and I feel like my joints kind of lock up a little bit, and especially when it's quiet and you're very still and you feel very tense, but I kind of lost that tenseness. I kind of felt that sensation where I felt like I was supposed to be tense, and it was in that moment, but I wasn't.
You were held in the sense of feeling secure, right?
Yeah.
You need to relax a little bit more. And then after a few moments, I placed my hand lower on your abdomen, right? Mm-hmm. Right by your rib cages and your stomach area. Did you feel a difference when I went there?
Yeah.
The same kind of thing?
Yeah, I felt slowly like these pangs that I would have, because when I'm really still, I get these sometimes pangs like at different parts of my body, and I'm like, that's a weird feeling. I don't know what that is, but it'll go away. And so I got that, but then they just all stopped.
That's good. And then I went down to your knees at a point. Do you remember that coming down here?
Yeah.
And that's when everything felt better or more relaxed?
Yeah, I think when you got down to my knees was when everything really stopped and it all came together. Yeah, and I started to feel a lot different sensations when you got down to my knees. Yeah, it was my whole body kind of gave in to whatever was going on.
To help you kind of de-stress in a sense, to let your body, all that tension that you hold, say it's okay to let it go. To be able to say you're in this moment, you're here, you're now, and just be present. That's good. And that's why I really stress meditation outside of Reiki treatments or acupuncture, treatments because it holds that in the moment, in the now, and gives your body a chance to kind of release all that tension to help the organs and, your focus be better. And let that resistance relax so it's easier to move forward with your day or whatever you're studying with. It's good to use that. And I'm glad you got to experience it. What about your feet? I usually end the practice grounding people just to bring their energy down, welcoming balance and centeredness to them. Did you feel any of that shift?
When you got down to my feet, I did feel like my body at the same time that it was very light and loose. I felt like instead of feeling like I was about to kind of lose that kind of sense of being there. It's hard to put in words, but yeah, I did feel like I was grounded by that. That is the best way I can describe it. Yeah.
That's good, and you're centered and balanced to move forward. So that's a really good thing. So what were your questions? I'm looking forward to your questions.
Yeah, I mean, my biggest question though is I was wondering like what other people like
feel?
Yeah, what other people feel like if my experience was anything like anyone else's. Like, I don't know if there's a way you're supposed to feel, but
everybody's different. Everybody experiences things differently. I had a patient laying on the table, and sometimes visions come, like images, and sometimes words come to me that it's like, ask this person this. So I had one patient where, there's a lot of trauma from childhood, and we talked about it, and we laid on the table, and then as I was doing the Reiki, this image of this sunset came up, but it was like purple and blue. It was nothing like of a sunset I've ever seen. So I felt the need to share it with this patient, and they said, "Wow, like they have that experience up in the northern U.S." I'm not going to share, locations and stuff like that, but it resonated with that patient and helped him to realize that, there were good moments. There were things that he could take from his experience as a child, as a young person, that weren't so bad, and those are his. So it had nothing to do with the trauma, but he still had good experiences. Another image that came up was, like in the winter time when there's a ton of snow and you dig a tunnel and you kind of hide in there and you throw snowballs at your friends. Like, that's another image that came up. So I shared that, and that resonated for them. So I think that helped that person to have whatever they needed, right?
Mm-hmm.
And then I have had other people where, like, I didn't know the woman's relationship with her grandmother, and all that kept coming up was like this image of an old woman and the word grandmother. So I said, is your grandma still alive? And she started crying. And her grandmother had passed recently, and she hadn't really gone through the grieving process of that. So on the table, she, we helped her. I helped her through that. So everybody's different. It depends on what we say in Chinese medicine is what walks through the door. We treat what comes through the door, and it's the same with Reiki. We never know, but we're open to believe that whatever the patient needs, the patient's going to get. So you just had so much tension, you needed some, like a breather in a sense, and you got that.
I feel like that's just a nice way of thinking about that, and when you have all those troubles and things like pent up, and I know like I have things, anxiety, like things that make me very anxious, and I don't find time to de-stress or unleash that tension that I have when I have all of these things built up. And when I was in that kind of state, when I was having the Reiki done, I felt like I needed more of that. Like, I wanted to relax more. I wanted more time to be still, to be quiet, to have that kind of self-care and to let go of that tension, because it felt good. It felt warm and felt light. I didn't feel so stressed and so just wound up. I really liked that feeling.
Good. So one of the ways to definitely try to keep that is even for 2 minutes. 2 minutes isn't a long time. It's less than the time that we brush our teeth, or we're running through the door to make a cup of coffee. Just 2 minutes. That when you start feeling that tenseness, that you kind of just take the 2 minutes and do that a deep belly breathing, and go back into that moment of how you felt, and kind of let go. So there's ways of getting that back and maintaining that through the day. And the more, it's called a practice. So you can get frustrated, but it's about incorporating that into your life. And I'll share with you that I'm studying for the herbal boards, the Chinese boards. And every time I get frustrated that I don't know the answer to like one or two questions, I have to remind myself that if I keep feeling that like frustration, I'm not going to retain anything I'm learning. So I have to consciously say, it's okay, let it go, take a few deep breaths, and then let my mind kind of relax to say, okay, I'm ready to learn. And tell my body, I'm ready to retain what I'm learning, rather than get mad that I got the answers wrong, or that I have to take the test at all. So, I'm kind of in your situation, but that's how I could share that when we create constraint and contrast and friction, it's harder to be moving through and letting you be and letting you go. And the more we tense up, the more problems that we have, like later on, that manifest later. Any other questions?
Yeah. So, while I was feeling everything and going through that and not really knowing what to feel, what did you feel? Like, did you, like, in relation to what I was feeling? Because I know, like, there seems like there's a connection between, like, the person who's practicing and the person who is receiving that energy. I was wondering, like, if you feel
anything?
Yeah, if you feel anything.
So, like, for me, as everybody practices differently, right? So for me, it's really important that I feel a rhythm with you, or my patients, and in the breath, like that we're together and we're synced. And when a patient, I can't feel it flow from one hand to the other, like a circular motion, and I'm trying to breathe with the patient, then I just feel locked and blocked. And then I know that they're tensed, or, it's not me, because I'm kind of open to channeling the energy through. So a lot of the times, like, I'll start breathing on my own and have them try to match me. So I take in charge. And then they seem to settle. Now for you, like I had said initially, I couldn't feel that circular motion between your shoulder and your leg. So I moved my hand to help you breathe. And then I started breathing deeper, and you heard me. And that's when you opened up and settled down. And I could feel that. And then when I moved down, a lot of the times we hold so much in the stomach area. And when you have a chest breath and not an abdominal breath, there's no flow coming through. So that's why I moved the other hand there to kind of help you open up, which helps to relax. It kind of says, okay, I'm ready to be open. And for me, what I feel, I don't really feel anything. I actually picture a white light coming through my head, through my arms, and to you, or through me to you. And sometimes I can feel, like, once I move my hand, I can feel the heat from my hand, especially the patient's side is cold, or some places cold. I can feel the difference, but a lot of the times I don't. So sometimes I could feel like if there's a lot of tension in the middle abdomen or the lower abdomen, I can feel like the intestines kind of releasing, kind of but that's about it. Other than, for me, I get words, I'll get images, sometimes a feeling will come over, so it depends on how, whatever comes through for me to share. And sometimes, like, I don't feel comfortable sharing some things. I'm like, oh my God. And I just have to ask for a way. Okay, give me a way to say it in a different way, or a way that's comfortable. But sometimes I don't, and I have to say what I get. So